Your brain controls everything you do. But what happens when the brain starts working differently? A harmless thought becomes an obsession. A little fear becomes a panic attack. A bad memory feels like it's happening all over again. And sometimes reality itself becomes difficult to tell apart from imagination. These aren't personality traits. They're psychological disorders. Today, we're going to explore psychological disorders and explain each one in simple words that anyone can understand. Narcissistic personality disorder. People with NPD often have an exaggerated sense of importance and a strong need for admiration. They may struggle with empathy and become very sensitive to criticism, even if they appear confident. Depression. Depression isn't just feeling sad for a day or two. It's a mental health condition where a person may lose interest in things they once enjoyed, feel hopeless, have low energy, struggle to concentrate, or even find it difficult to get out of bed. Eating disorders. Eating disorders include conditions like anorexia nervosa, bulimia nervosa, and binge eating disorder. They involve unhealthy eating behaviors and often a deep concern about body weight or shape, which can seriously affect physical health. Schizophrenia. Schizophrenia affects how a person thinks, feels, and experiences reality. They may hear voices that others can't hear, believe things that aren't true, or have trouble organizing their thoughts. With treatment, many people with schizophrenia can lead meaningful lives. Alexithymia is a neuropsychological trait often described as emotional blindness, characterized by severe difficulty identifying, understanding, and describing one's own emotions. It is not a mental disorder, but rather a way of experiencing emotions that often co-occurs with autism, PTSD, and depression. Bipolar disorder. Bipolar disorder causes dramatic changes in mood, energy, and activity levels. During manic episodes, a person may feel extremely energetic, confident, or impulsive. During depressive episodes, they may feel deeply sad, tired, and hopeless. Hoarding disorder. People with hoarding disorder have extreme difficulty throwing away possessions, even items with little value. Over time, clutter can become so severe that it affects daily living. Obsessive-compulsive disorder. OCD involves unwanted, intrusive thoughts called obsessions that create anxiety. To reduce that anxiety, people often perform repetitive actions called compulsions, such as checking locks over and over or washing their hands repeatedly. OCD is not simply being neat or organized. Attention deficit hyperactivity disorder. ADHD affects attention, self-control, and organization. Someone with ADHD may become easily distracted, forget important tasks, interrupt conversations, or struggle to sit still. It's a neurodevelopmental condition, not laziness. Paranoid personality disorder. People with this disorder are deeply suspicious of others and often believe people are trying to deceive or harm them, even without strong evidence. Body dysmorphic disorder. Someone with BDD becomes obsessed with flaws in their appearance that other people may barely notice or not see at all. They may spend hours checking mirrors or trying to hide the perceived flaw. Post-traumatic stress disorder. PTSD can develop after experiencing or witnessing a traumatic event, such as violence, war, or a serious accident. People may relive the event through nightmares or flashbacks, and often avoid reminders of the trauma. Insomnia disorder. Insomnia means having ongoing trouble falling asleep, staying asleep, or waking too early. Poor sleep can affect mood, memory, concentration, and overall health. Antisocial personality disorder. This disorder involves repeatedly ignoring the rights and feelings of others. People may lie, manipulate, break rules, or act impulsively without feeling much guilt or remorse. Borderline personality disorder. People with BPD often experience very intense emotions and may struggle with relationships, self-image, and fear of abandonment. Their emotions can change quickly, making everyday situations feel overwhelming. Anxiety disorder. Anxiety is more than just feeling nervous before an exam or interview. People with anxiety disorders experience intense fear or worry that doesn't go away easily. It can make everyday situations feel overwhelming and may cause symptoms like a racing heart, sweating, shaking, or trouble sleeping. Dependent personality disorder. People with this disorder rely heavily on others to make decisions and provide reassurance. They often fear being alone or abandoned and may struggle to act independently. Dissociative identity disorder, a complex mental health condition. It is characterized by the presence of two or more distinct personality states, often called alters, and recurrent episodes of amnesia, where an individual cannot recall personal information or past events. Trichotillomania. This condition causes repeated urges to pull out hair from the scalp, eyebrows, eyelashes, or other areas. Many people describe feeling relief after pulling the hair. Phobia. A phobia is an intense, irrational fear of something like spiders, heights, needles, flying, or enclosed spaces, etc. The fear is much stronger than the actual danger and can interfere with daily life. Tourette syndrome. Tourette syndrome causes involuntary movements or sounds called tics. These can include blinking, shoulder shrugging, throat clearing, or repeating words. The severity varies from person to person. Substance use disorder. This disorder involves repeatedly using alcohol or drugs despite serious problems at work, school, home, or with health. Addiction changes how the brain works, making quitting very difficult without support. Autism spectrum disorder. Autism is a neurodevelopmental condition that affects communication, social interaction, and behavior. Some autistic people prefer routines, have intense interests, or experience sounds, lights, or textures differently. Every autistic person is unique. Derealization disorder. Derealization disorder, a mental health condition characterized by persistent or recurring feelings of being detached from one's own body, or feeling that the world around you is unreal, dreamlike, or artificial. Derealization. People with DPDR always maintain the awareness that these altered feelings are just perceptions and not reality, which differentiates it from psychosis. Mental health disorders are real medical conditions, not personality flaws or signs of weakness. Many people improve with therapy, medication, lifestyle changes, or a combination of treatments. The more we understand mental health, the more compassion we can show to ourselves and others. Which psychological disorder would you like me to explain in detail next?